Well, the symptoms of Niemann-Pick type C disease are very variable and can happen at any age. They can start in the infantile form with not reaching milestones, not being able to feed properly, being floppy, and perhaps not being mobile or being able to eat, those kind of things, and that would be recognised and investigated at that point. Later on, perhaps when children reach school age, their symptoms might be a little bit different. So in the classroom they might be perceived as being clumsy or not able to keep up with their peers, forgetful perhaps, so told to do something one day and then forget to do it the next. So they would be the initial symptoms that you might see in a school age child. And then as you get a bit older, perhaps as a teenager, there may be some psychiatric issues, and then the juvenile form, which is the teenagers, that they would have psychiatric issues and possibly mobility issues. And then what we usually say is it depends on the time that the neurological signs of the condition show up as to what the progression of your disease may be. So if you show neurological symptoms at age 2, you might pass away at age 4, but there is no scientific base for that. It's just an observation that we have seen within our community. It is a problem. Yes, there are lots of initial symptoms that cross over into other lysosomal storage diseases, and in fact other rare diseases and some common conditions as well. So things like seizures. So they might show up immediately and be investigated, and you might be given a diagnosis of epilepsy initially, and it wouldn't be until other symptoms began to appear, and then you can join the dots between those symptoms that you would realise it was Niemann-Pick disease. One of the most prevalent symptoms that we would say for people to look out for would be vertical supranuclear gaze palsy, or VSGP, which is the inability to move your eyes up and down. And that's quite a classic symptom of Niemann-Pick type C.